Have you ever lain in bed wide awake, watching the night pass, and wondered why your mind will not switch off? You are not alone. In this video, here is what we will cover in very simple language. What insomnia is, how much sleep most people need, why poor sleep happens, what it does to your body and mind, the signs you should never ignore, exactly how to fix your sleep with practical steps you can start tonight. Do not forget to subscribe to the Medical Diary for more clear health guidance in everyday words. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, United Kingdom, medicine specialist, diabetes and hormone specialist. Information has been collected from trusted sources, including National Institute for Health and Care Excellence, Cleveland Clinic, Mayo Clinic, and patient information. What is insomnia? Insomnia means poor sleep. It can look like different things. You cannot fall asleep. You wake up too early. You wake at night and stay awake for long. You wake up unrefreshed even after a full night in bed. About 1/3 of adults do not get the sleep they would like. When this continues, it affects energy, focus, mood, work, and safety. How much sleep is normal? Different people need different amounts. Most adults feel well with 6 to 9 hours. Children and teenagers need more. Older adults often sleep a little less and may take longer to fall asleep. What matters most is this: you feel refreshed. You are not sleepy in the day. Your function is good. A quick tour of normal sleep. Sleep runs in cycles. There is light sleep. There is deeper sleep that helps learning and memory. There is the deepest sleep that restores the body. There is rapid eye movement sleep when most dreaming happens and emotions process. Across the night, you move through 4 or 5 cycles. It is also normal to wake for a minute or two between cycles and not remember it. Why insomnia happens? Sometimes there is no clear trigger. Often there is a simple cause. You worry about not sleeping. You clock watch. The worry itself keeps you awake. Temporary stresses do it. A new baby, travel, a change of routine, exam week, mental health plays a role. Anxiety, low mood, and persistent negative thoughts keep the brain alert at night. Sleep apnea can fragment sleep, especially with loud snoring, daytime sleepiness, and morning headaches. Other illnesses disturb nights. Pain, breathlessness, cough, hot flushes, heartburn, itch, restless legs. Stimulants make it worse. Caffeine from tea, coffee, cola, and chocolate. Nicotine from smoking. Alcohol helps you drop off, but then breaks sleep and makes early waking more likely. Screen light late at night confuses the body clock. Laptops, tablets, and phones close to the eyes delay natural sleep signals. Some medicines disturb sleep. Examples include diuretics, certain antidepressants, steroids, beta blockers, and decongestants. Stopping regular sleeping tablets can also cause rebound poor sleep. Unrealistic expectations matter. Some people simply need less sleep. If your pattern is unchanged and you feel fine in the day, you may already be getting enough. When poor sleep becomes a loop, you have a few bad nights. You start to fear the bedroom. You try harder to sleep. You lie in late. You nap. The body clock drifts. The problem grows. The goal is to break that loop gently and consistently. Warning signs you should not ignore: severe snoring with gasping or choking at night, breathlessness, chest pain, depressed mood with loss of interest or thoughts of self-harm, sleep attacks in the day, or near sleep paralysis with fear. If these are present, speak to a healthcare professional. How a diagnosis is made. Often your story is enough. Sometimes tests help. Sleep apnea testing in a lab or at home. Brainwave recording called electroencephalogram in specific situations. Actigraphy with a wrist device to map sleep and wake times. Daytime sleepiness and wakefulness tests when conditions like narcolepsy are suspected. Now the most helpful part: how to sleep better. Start with understanding a few facts. Short, wakeful moments at night are normal. A few bad nights during stress are normal. Worrying about sleep makes sleep harder. Next, build strong sleep hygiene. These are simple habits that support the body clock. Set one fixed wake-up time every day of the week. Yes, weekends too. Go to bed only when you feel sleepy. Avoid naps in the day. If you must nap, keep it under 30 minutes and not after the afternoon. Keep evenings gentle. Stop caffeine at least 6 hours before bed. Avoid nicotine in the evening. Avoid alcohol near bedtime. Eat a light dinner. Leave 3 hours between dinner and bed. Move your body most days. Aim for at least 30 minutes of moderate activity on 5 days each week. Avoid vigorous exercise in the last 2 hours before bedtime. Power down screens 1 to 2 hours before bed. Put phones and laptops out of reach. Use a printed book or an e-reader with warm light if you like to read. Create a wind-down routine. The same steps every night: a short walk, a warm shower, deep breathing, gentle stretches, soft music, a warm, caffeine-free drink. Make your bedroom a sleep sanctuary. Dark, cool, and quiet. Use blackout curtains or an eye mask. Keep the room slightly cool. Try a fan or white noise if sounds disturb you. Use the bed only for sleep and intimacy. Hide the clock so you are not tempted to check the time. What if you are lying awake? If you are not asleep after about 20 to 30 minutes, get out of bed. Go to another room. Do something calm and dull. Return to bed when sleepy. This retrains your brain to link bed with sleep, not frustration. Relaxation techniques that truly help. Practice slow nasal breathing. Inhale gently. Pause. Exhale longer than you inhale. Try progressive muscle relaxation. Tense, then relax each muscle group from toes to forehead. Use guided relaxation or mindfulness audio to quiet the racing mind. When self-help is not enough, cognitive and behavioral therapies have strong evidence. They retrain thoughts and habits that keep insomnia alive. Stimulus control helps you rebuild the bed-sleep link. Sleep restriction limits time in bed to match actual sleep, then slowly increases it as sleep becomes deeper and more efficient. Cognitive therapy challenges unhelpful beliefs like, I must sleep 8 hours or tomorrow will be ruined. These therapies can be delivered in person or digitally. Digital cognitive behavioral therapy for insomnia programs approved by health authorities are increasingly available. A note on sleeping tablets. They can have a short-term role for a crisis, but they do not fix the cause, can lead to dependence, and often stop working with regular use. Use them only when your healthcare professional advises, for the shortest possible time, and always alongside behavioral strategies. Diet and lifestyle that support sleep. Choose a plant-rich diet with lean proteins, whole grains, fruits, vegetables, nuts, seeds, and healthy fats. Keep sugary snacks and late-night heavy meals away from bedtime to prevent heartburn and glucose spikes. Avoid large volumes of fluid near bedtime to reduce nighttime bathroom trips. Quick recap you can screenshot in your mind. Keep a fixed wake time. Go to bed when sleepy, not by the clock. Power down screens early. No caffeine after the afternoon. Light dinner and no late alcohol. Move daily. Make the bedroom dark, cool, and quiet. Get out of bed if you cannot sleep, then return when sleepy. Ask for help if snoring with gasping, low mood, or daytime sleep attacks are present. Insomnia is common, and for most people it is fixable. With steady habits and, when needed, targeted therapy, your sleep can recover. When sleep improves, energy rises, mood lifts, focus returns, and life feels manageable again. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP United Kingdom, medicine specialist, diabetes and hormone specialist. Sources include National Health Service United Kingdom, National Institute for Health and Care Excellence, Cleveland Clinic, Mayo Clinic, and patient information. Subscribe to the Medical Diary and share this video so that more people can sleep better and live better.